Hello, everybody, and welcome to this edition of Taking Control of Your Diabetes, the podcast. I'm your host, Dr. Jeremy Pettis, joined as always by my good friend and colleague,
Steve Edelman.
All right. And today we're talking loosely about kind of the emotional side of diabetes. And if you're listening and wondering what that means, it means if you've got diabetes and you're just pissed off about it, you know, what's that like? What does it mean? Everybody's dealing with this. And importantly, what can we do about it? So, Steve, I think you would agree that we're joined by the premier expert in this topic, Dr. Bill Polonsky. So tell us about Bill, Steve.
Yeah, but first let me just say, not everybody with diabetes distress is pissed off.
Well, I am.
Okay, you are. But there's a lot of different emotions out there. And that's why we have Bill and not you talking about this topic.
Oh, okay. Jeez, I'll leave.
Yeah. So for everybody, if you don't know Bill Polonsky, you're a loser. That's how I'm going to start off. And Bill Polonsky has spent his entire career studying, talking the behavioral and emotional aspects of diabetes. He started the Diabetes Behavioral Institute, which is really a one-of-a-kind organization that focuses on these issues in people with diabetes. And he also is the winner of the honorary diabetes degree, which means that he is someone without diabetes himself, but knows very much what it's like to have diabetes. And we're lucky to have Bill.
And you never say who gives out that award. It's very important.
Well, because I know you always ask me. It's Taking Control of Your Diabetes. Mm-hmm. And we've only given out 3, Ian Bloomer and Tricia Santos. It's a very unique award, and we don't just hand it out like candy.
Highly coveted. Comes with what, $20 Target?
Yeah. Now, before we start, I'd like permission to ask Bill the very first question.
Please.
You know, there's very few people like you, Bill. I know there's a handful of people that specialize in this area. How did you get into this area?
Well, thanks, Steve. I wish I had like a really great story. Like, you know,
just make it up.
My little sister, and I nursed her back to health. But in truth, what happened is I just by happenstance lucked into a job as a psychologist, and I may have been the first psychologist at the Joslin Diabetes Center in Boston. And I'm by training what's called a clinical health psychologist. I didn't know much about diabetes, but I was very lucky to have this job. They didn't know what to do with me. I wasn't sure what I was supposed to do. It was sort of this thought. They said, well, why don't we just have a psychologist here for like 6 months and see what happens? And I said, oh, okay. And not knowing what to do, luckily, the Joslin is the largest diabetes center in the world, so they have a big waiting room with lots of people. So I started walking around and asking folks. I would sit with them and introduce myself and say, could you tell me what living with diabetes is like for you? And I still remember the first time I ever did that, because the first person I asked sort of looked at me in shock and said something that really surprised me. She said, thank you. And I went, what? She goes, well, no one's ever asked me that question before. I said, well, I'm asking you now. So she was nice enough to tell me about, you know, what she was going through and some of the struggles that I didn't really know about. And I went to the next person in the waiting room, and the exact same thing happened. And actually, by the end of, I'd say, a couple hours, I was introducing people in the waiting room to each other. I think we had our first informal support group. And I've just been very lucky ever since then. That was 1987, 1988, and just had the chance to meet so many wonderful folks, thousands now, over all these years. And I've been honored to that they would be willing to share their stories with me and learn about what's gone well, where they've struggled, work with them to figure out what to do to make things better. So it's been a great ride.
Yeah, and I think, just thinking that, why are we talking about this? And I personally believe, I'm biased, that diabetes is a uniquely difficult disease. I mean, I can't think of something else that requires such 24/7 vigilance. The constant monitoring, testing your blood sugar, looking at your CGM, taking your medications, the constant quote-unquote failures daily of I'm going low, I'm going high, all on the backdrop of if I'm messing up, gosh, what is this doing to my eyes, my kidneys? Not to mention the literal cost of the medications and the time. I mean, the list goes kind of on and on and on. And we talk about this.
Jeremy, I have to stop you.
Yeah.
We have to stop the podcast. Bill's here. We have a couch. Get on the couch. He can treat you right now.
Yeah. I was like, oh, geez, man, what's happening? But no, I think it's important to level set about why are we talking about this? What are people struggling with out there? And I think everybody listening can relate to in some way, including Steve and I. Steve was just showing me, his CGM from yesterday, and I haven't shown you mine yet because it was actually worse than yours, Steve. But just your numbers weren't even that bad. You were actually in range most of the time, but you had a low, and then you kind of rocketed up, and you went low again. That classic roller coaster. That even if your A1C is okay and your numbers are quote unquote good, God, what a pain in the butt it can be. And sometimes, Steve, people are pissed off.
Yeah,
along with other emotions.
Thank you.
So Bill, I got a list of questions here for you. So in that vein, what kind of problems does a diabetes psychologist see? What does somebody walk in the door and say to you?
Well, I think it's a huge variety. So I would say sometimes what they'll come in with is, I think you're referring to it, it's just people come in and say, I'm so tired of this. That's probably the most common thing. I'm just so tired of having diabetes. And most of the emotional issues that come up really have to do with people struggling about, why can't I do a better job with my diabetes? Feeling like they're failing, feeling like they're being aggravated by people in their lives. I mean, really, it's a range of things about, how do I fit diabetes into my life in a way that doesn't drive me out of my mind? So it's really, I would say the major thing is about people struggling with diabetes in that way. Sometimes it's about their weight. Lots of times it's about people dealing with specific issues about hypoglycemia or concerns or worries about complications or developing complications or battles with their loved ones. It's a big range of different things that people come in with.
Well, it sounds like very few are pissed. It's true. Did you hear he didn't say the
undertone of all that is anger. That's what they say first. And Jeremy, I'm pissed off, and I have this. So while you're talking, Bill, you said people are feeling like they're failing. And how often do you think that is set to a concrete measurement? I'm failing because my A1C is not 7, or is it just a general sense of I should be doing better?
Yeah, I would say it's 50-50. Sometimes people really do feel like they are failing because they've been told they're failing. Like their doctor says your blood sugars aren't good enough, your blood pressure isn't good enough, and they talk about real numbers, but probably the majority of the time that's not true. Just people feel they're failing because of what happened today. Like I overate at lunch, or I had a crazy blood sugar experience. It can be something very small, and just there's a sense of defeat. And sometimes they're pissed off. Sometimes they're just sad and discouraged and scared about what might happen to them.
Jeremy, that's an excellent question. And we see people who work their butt off. They get their A1C down to 7.1, and most doctors say, "Oh, it's not less than 7. You need to work harder at that." Or they look at the lab results, where a pathologist puts the normal range for people without diabetes, and they think they're failing because it says H next to 7.3, which is really a damn good level blood sugar or A1C. So that is a good question, and people just generally feel like they failing everything. In fact, they get pissed.
Yeah. Thank you. This is the theme of this podcast. So, I was going to say, I kind of asked that because I see a lot of patients that are objectively meeting their glycemic goals. Type 1s, their time in range is, let's say, 75%. And I'll say to them, you are doing well. You are meeting goals. You are in a safe place. And there's generally this sense of, yeah, but they don't believe it. I could be doing better. I'm still not, healthy enough. So I'm constantly reminding people, if you are achieving these metrics, which we set for reasons that we know if you get there, you will live a long and healthy and potentially complication-free life. So for God's sake, celebrate those. But there seems to be this kind of nagging, like, gosh, like I can do better. And that's hard to kind of pull apart, I think, sometimes for people.
Yeah, and I think you might probably see that more in folks with type 1, especially if they're more achievement-oriented. And it's probably because of this deeply held belief that we see in other disease states, which is just this belief that the lower the better. right? So we don't have to make this complicated. I don't care if you have an A1C goal for me of 7.0% or less. The lower, the better. That means I'm safer. The lower the better with my blood pressure is the safer. But one of the things that we know about it, if you step back and think about it, that's crazy, right? Because the lower the better is not true. It's lower the better to a point. And that's not clear to lots of folks. Mm-hmm. That's not clear that you have vanishing benefits once your A1C gets below a certain point. Or actually, your blood pressure can get too low, and that can be a problem. Your blood sugars can get too low, and that could be a massive problem. So we simply don't communicate that well enough.
Bill, we have a lot of folks listening from over 100 countries to our podcast, which is awesome. Type 1 and type 2. What are some of the most common things you hear from people with type 2? You've already mentioned weight. We know that's a big frustrating area that leads to diabetes distress, which we might talk about next. But what are some of the real common things people with type 2 diabetes talk about with you?
I think one of the biggest ones is shame. I think shame is very important. And of course, it's not really necessarily people do that to themselves, but we do that to folks. That we know that type 2 diabetes in particular is one of the rare diseases, at least in America, where we kind of think it's okay to blame people for getting it.
Yeah.
Kind of like how we blame people for being overweight. Mm-hmm. It's not fair. It's not accurate. It's not true. Many people even listening to us may not even believe it. But we know that's the biggest problem. And when you're shaming and blaming people for, well, it's your fault your blood sugars are high. It's your fault you could develop type 2 diabetes. It's your fault you're overweight. You're not doing enough. You're lazy. You're not self-disciplined. People take that to heart, right? They take it to heart. They blame themselves. And that doesn't tend to motivate and mobilize anybody to do anything. It just makes you want to put your head in a hole and say, I don't want to think about this anymore. So it's a really big problem that comes up over and over and over again. And dealing with that sense of shame and doing something about how we blame people is really an important first step to help people be able to feel interested and engaged to want to take positive action.
Yeah, I mean, I always talk about that too. That is so unique about type 2 diabetes, because if somebody came to you with pretty much any other illness, hey, I got cancer, I have pneumonia, your initial response would be, oh my gosh, I'm so sorry. But it's, hey, I have type 2 diabetes, and they get kind of looked up and down, and yeah, I see that, like, because you ate yourself into that or whatever. And it's really inappropriate, and it can be really harmful to people and can make them really disengaged.
What about syphilis?
Yeah, maybe that's what you see patients for. But
I just want to highlight what you're saying. We do not blame and shame people for any other chronic illness condition in the universe except for type 2 diabetes.
I should say to our listeners that in our video vault on our website, we have lots of good lectures about type 2 diabetes and why is it that over 95% of people with type 2 have weight problems, the central what we call adiposity in medicine. So it's part of the genetic defect that causes type 2, along with high blood pressure, abnormal cholesterol. And that you take those three conditions, you're going to be on 4 to 5 medications. And that's a whole other issue that you deal with all the time. I've heard you say, patients equate the number of medications to how sick they are.
Absolutely.
And so, type 2 diabetes, we share a lot of things with type 1s, but they really have that metabolic syndrome that really sets them up to be overweight, and then all the other things that they have to deal with, because, our society is prejudiced against people that are overweight.
Yeah, and I think another big issue, I know I see folks for this, is that if you're struggling with type 2 diabetes, oftentimes, at least in our society, they probably have other healthcare problems too. And there's a sense of, what am I supposed to do? And maybe they think, well, I'm supposed to, just start eating perfectly, or my doctor told me I'm supposed to lose 50 pounds. But there's this sense of paralysis, because what can I do that's going to really make some significant difference to moving forward? And I see that people often get lost with that. They just feel overwhelmed.
So let me ask you. So we've just kind of laid out a laundry list of issues that people can have. It can be weight, hypoglycemia, all these kinds of things. A lot mentally for people to deal with. And when I see patients that are struggling with something that I identify as an emotional aspect of diabetes, and I ask them to see you, and we're very fortunate to have you local, you're very amenable to getting people in. I would say about 1 out of 10 of them actually call you. And this has nothing to do with you or your expertise. It's just that there's some barrier there I don't know if it's just the idea of psychological care, but it seems to take a lot for people to admit, if you want, that they have an issue, and then to seek help. So how do you even see that, or you're only seeing the people that actually come to see you? So what does it take for people to finally make that choice?
Yeah, well, I think what you're identifying is very common, and I think, and you've mentioned it, but there's two big reasons why oftentimes people don't follow through. One is, well, we know what psychologists are. I'm going to have to lie down on a couch, and that's really only for weak people anyway. And if you're already feeling shamed and blamed, I don't want to go to see a psychologist, to see a psychiatrist, to see a therapist. I've already lost. You're sort of one down. And this is just someone else is going to judge me or et cetera. But there's a sense of, again, it's more shame. It's more blame. It's not necessarily perceived as something that's going to be helpful. And we know that one of the things that works best for people like me is when there's some kind of warm handoff. So if I have a chance to be in your clinic, for example, as I often do, and actually get to meet someone in the flesh, when that referral happens, and they go, "Oh, you look fairly, well, I'm not totally normal, but fairly normal," and there's a greater comfort in saying, maybe this might be worth trying at least once, maybe. So there's all those sorts of reasons why it can be tough, though.
Bill, one topic that we've talked about before is this whole topic of diabetes distress. You have developed a scale, and I know you're updating the scale, how to measure diabetes distress. And how is that different than diabetes depression? Because I know years ago, all the headlines of the diabetes journals were, depression is, 5 times higher in people with diabetes, and I know you have some thoughts on that.
Yeah, we've actually written a lot about this. So we know that, as you mentioned, we used to think, well, if people are having all these emotional feelings, whatever it might be, or as Jeremy might say, they're just pissed off.
Because they are.
We would just say, we used to just say, oh, that's just depression. People are just depressed. They don't look depressed, but they're depressed. And, our most recent evidence suggests that's not true. I mean, the combination of depression and diabetes does happen. When it does, it's pretty bad. But it's not as common as we thought. And what we thought was depression was people just being, well, what we're talking about, really upset, freaked out, and overwhelmed about diabetes, pissed off, discouraged, embarrassed, shamed, isolated, feeling helpless and hopeless. And the reason that's an important distinction, because it's not depression, because it's something unique. It's diabetes distress, or sometimes we call it diabetes burnout. That's important because diabetes distress doesn't respond to an antidepressant pill. And that's why it's important to, when it's possible, to see, when it gets severe, to see a mental health professional, even though, people do what I do is pretty rare, unfortunately.
So along those lines, if you do have diabetes distress, or, there's something in your life of diabetes that you want to address, what can you do about it? So if you have a Bill Polonsky down the street, great. But if you don't, what are some, you talk about some concrete things that people can do.
Sure. Well, first I'd say, the majority of people don't need to see anyone like me. That if you ever feel overwhelmed or angry or upset or pissed off, you should know that's normal. It doesn't mean it's great, but normal. You should know that's...
It's normal to be pissed off.
It's really common. We've done tons of studies. We understand how common the sense of feeling overwhelmed and burned out and seeing all these emotional problems associated with diabetes. The issue becomes when it gets really overwhelming. So I will say, first of all, when it's really big and you really do want to see a mental health professional, people should know about what the American Diabetes Association Mental Health Registry. And all they have to do is Google that or go to diabetes.org. And you'll see a search box and put in mental health registry. And you can put in your zip code and you can find out if there are diabetes knowledgeable mental health professionals in your area who you might call, you might contact and see if you might want to see them, if that's something that's covered by insurance, if it's affordable or not. But just day to day, when you're dealing with some of these emotional issues, there's a ton of things you could do. One of the things that we've talked about, and I won't go through my long list now, but just to mention one is, we think it's important for people to, get perspective, right? We're always talking about this, and we've talked about this at TCOID since its inception, which is an idea that it is our job as healthcare providers to tell people the real facts in the 21st century and to help provide people with what we call evidence-based hope. That if you develop type 1 today, if you have type 2 now, you're not doomed. This is not a death sentence. And we know that with good care and effort, odds are pretty good. You can live a long and healthy life with diabetes. And we also think about the words we use. And Jeremy, I'm hearing you do this all the time. It's wonderful. We talk about...
That pisses me off. You have not complimented me once.
Well, I'm waiting. It's too easy to compliment
Let the man
Steve.
talk, Steve. Okay, go on, Bill. What were you saying?
If your A1C is elevated, we talk about it being in an unsafe place. We don't say it's good or bad. We don't say it's high or low even. We like to say it's safe or unsafe. If your blood pressure is elevated, we like to talk about it being safe or unsafe. And the reason those words are so important, which is what I do hear you both always use now, is because it takes the shame away. We're not being judgmental. I'm concerned you're in an unsafe place. That means there's something we should pay attention to, something we can do about it without having to be pointing our fingers at folks. So there's lots of things we can talk about, but those are just a couple.
Well, I'm glad that we stumbled on this again, that I think level setting, that diabetes does not mean doom and gloom always, that you can have control over it. It can even end up being a positive thing, as it has been for Steve and I, of using it to shape your life, your career, all these, these positive things. But at least engaging with your health and, watching what you eat and observing your weight, all these kinds of things. And we talk a lot about all the data now that in people that are reasonably well controlled with type 1 diabetes, they can live just as long, if not longer, than people without diabetes. And that's something that, Steve and I, we always talk about, that both of us, when we're in the hospital diagnosed as 15-year-old kids, people told us multiple times, well, you just lost 15, 20 years of your life. And that is just not true anymore. So I think people living with diabetes really need to hear that. If you are controlling your diabetes, you are healthy, period. And I remember doing a talk at TCOID, and I made people, it was a virtual thing, and I made that statement. It said, you are healthy. I said, everybody say it. I am healthy. And I was kind of surprised to see everybody actually typing it in the little chat, like, in all caps. But I think that's so important to gain back some control of your life and start there. And also realize, if you are controlling your diabetes, you can still also struggle with mental health, but kind of unpacking these things as separate issues. I want to address my A1C, my blood pressure, and my lipids, and also keep an eye on how am I doing mentally with tackling all these things.
Yeah, and the truth is, you can be successful with the job that diabetes is, the work you have to do, but it's still a job.
Yeah,
and it gets wearing, and it gets exhausting, and that's, again, a big source of stress for folks. When you're really putting in the effort and time, why wouldn't you get fed up with it and overwhelmed and sick of it over the course of time?
And we talk about celebrating the little victories because, Bill, you taught us this, that, diabetes is you're working your butt off all day, every day. And what's your ultimate goal? Your ultimate goal is nothing. Like, you don't want anything to happen. And so how can you work so hard all the time just for nothing? So there's got to be some positive payout, like, I just ate, 3 donuts and I bolused and didn't go high, or I exercised without going low, or I slept all night without waking up, or I had an eye exam that went well. And we talk about these things as almost throwaway comments, but it's really important. And that doesn't necessarily mean throwing a party, but just a moment of self-reflection, like, I just kind of cleared that diabetes hurdle and everything was okay. And I'm going to at least give myself a pat on the back, or better yet, text Steve. We'll put his phone number at the end of the podcast. Kind of like talk about it with a friend.
I like throwing a party. That's a good idea. Bill, I wanted to ask you, there's a lot of people listening who care about someone living with type 1 and type 2, and, address this answer to the significant others. How could they help? And importantly, how could someone with diabetes having problems engage the right type of help from their type 3 partner?
Sure. I'm so glad you asked that. So if you care about someone who has diabetes, type 1 or type 2, and you really want to be of help, the single most important thing I can tell you is this: you don't really know how to be of help. And the most important thing you could do is to ask Where we see trouble happen, where people end up becoming the diabetes police and start nagging, is because they care, they want to help, but they actually don't really know the best thing. They've got their own idea what to do, but they've never asked the expert in the room, which is the person with diabetes. So the single most important thing you could do is to ask your loved one, the person who has diabetes, look, I'm rooting for you. I'm on your side. What can I do that can make this easier for you? What can I do just to let you know I'm here for you? Maybe that means I can, we go out and have donuts together every once in a while. Mm-hmm. Maybe that means you're trying to be more physically active. Let's do that together. You're trying to follow a most diabetes-friendly way of eating. That's a good idea for all of us, right?
Yeah.
It's just a healthier way of eating.
Just simple communication.
Just ask.
Yeah.
Yeah, and I think, I love that. It seems so obvious, but the other thing I always say about that is ask in a time that it's not a diabetes code red situation. I find that these
Yes.
conversations usually come around when, blood sugar's 50 and get me juice and, oh, you never helped me and might then it becomes this big thing.
That pisses me off.
It really does.
We're back to that. Excellent.
So, actually having a conversation around diabetes when it's a Sunday evening and you're watching TV and, there's nothing pressing diabetes going on. But it never generally comes up that way. But it's ever present in not just like a romantic relationship, but all relationships. Mm-hmm.
That's such good advice.
Yeah, we always
for
say
everything in life.
We always say the only way to do this is you want to pick a dispassionate moment to have that conversation.
Not code red. Not when you're pissed off. I guess.
Exactly.
So, Bill, I hope the answer to this is something positive. But, people come to you for a wide array of reasons. And how often do you see them get better? I mean, is there hope for people that are feeling it's just that they can't win?
I see that the vast majority of people who come to see us do get better, get dramatically better. We know we can help almost everybody. It is a very, very rare individual who we haven't been able to help. And when that happens, it breaks my heart. Luckily, it's very, very rare. So one should have hope about that as well.
Mm-hmm. And are these things that, again, kind of come from within that people can trigger themselves, that you just kind of help give them the push? Or I'm asking more, again, if there's somebody who's in the middle of the country and they can't see, a diabetes specialist, are there things that they can do to set them on the right path?
There's always, I think I want to be clear about this. For the vast majority of people who are really struggling with the emotional side of diabetes, there isn't going to be a mental health professional who's knowledgeable enough about diabetes. Right. There just aren't enough. So it means talking to your loved ones, like we talked about. Like I've always said before in other venues when we've spoken, the single most important thing we always say is don't do diabetes alone. When you've got people in your life who are rooting for you, and especially when you get a chance to meet other people with diabetes who get it. I think every child and adult should go to diabetes camp. Talk about the One Conference, for example, you guys like to do once a year. But, that's the single most important thing. And it's something I know that you provide in the limited time you have, even when you see your own patients, to let people know that if you're having a tough time, what they really need is not a solution. They just need a hug, and you're doing your best, you're putting out your effort. We can begin to think this through. We can do this together. And I've met folks who will tell me, I used to be really struggling with my diabetes. I was fed up. And now I found a way to make peace with it, and I've engaged with it. And I ask them all the time, well, what the heck changed? What was that aha moment that made a difference? And very often it was something that happened between them and either a healthcare provider or a friend. And it's the simplest thing in the world. I remember someone saying to me, I met a new endocrinologist and he changed my insulin and made some other changes. And I didn't think much of it, except he called me on the phone a week later just to see how I was doing. And she said, and that was it. She goes, I was in shock. And if he cared enough to call me just to see how I was doing, I guess I could care about my diabetes as well. And that shifted everything for her, with the sense that I've got a healthcare provider who's not judging me, but is on my side. Mm-hmm. And we see that all the time, whether it's a healthcare professional, it's meeting someone in your life who's, maybe you're interested in, or who just cares about you. All these things really matter. So don't do diabetes alone. Think about how you can reach out, whether that means your life now, it means reaching out to resources online to other people who you can contact. That's the key, I think.
That's awesome, Bill. Well, as we get to the end of our program, that was a perfect way to end it on your end. I can hear from you too, Jeremy. But see, when I just sitting here thinking of all the patients I see who have A1Cs that are pretty high, above 9%, 10%, it is the rare individual that doesn't have some emotional issues going on with their diabetes, whether it's adhering to the medication, to the lifestyle.
Sure.
And I really think that if more people would seek out help from a Bill Polonsky or Bill Polonsky type of person, the world would be a better place. And I just think only a fraction of people would consider going and getting some help.
Yeah, I was just going to say that I feel a lot better just sitting here listening to Bill, and not the words he's saying, but just the melody of his voice. And I think you should do like a meditation app or something. Like,
I think you should run a sex talk show. You see how soft and sexy
I know, and it got
getting?
softer and sexier as the podcast
Oh
went
my
on.
God.
I was in a trance here for a
I'm
little
glad
bit.
there's no cameras
Oh, yeah,
on our
seriously.
podcast.
All right. Well, Bill, we love you. Thanks for stopping by. This is a great, great topic. And I'm sure we'll have you back on many times. I'm hoping to do future episodes with us.
And Bill has many video productions on the TCOID website.
Mm-hmm. And books. Anything else you want to say about Bill Polonsky?
I don't need to push anything. Just know that I'm just happy to be here. Love you guys. Happy to have anything to do with TCOID, and wishing everybody well.
All right, guys. So this is going to wrap up this edition of our Taking Control of Your Diabetes podcast. Make sure to share with your friends, like us, all that kind of social media stuff. And
TikTok,
we'll see you next
Tinder,
time.
anything.
All right. Bye-bye.
Bye.